Spaying is the common term used to describe the surgical procedure known as the ovariohysterectomy. In this procedure, the ovaries and uterus are removed completely in order to sterilize a female cat. In this video, we will tell you about the 7 tips for spay and neuter care for cats before and after surgery. Number 7. Pre-operative care. All animals must have food and water withdrawn the night before surgery at 12 o'clock midnight. Animals must be in good health, so if your pet is showing any signs of illness such as coughing, sneezing, runny eyes, or diarrhea, it is possible that they will be declined for surgery. If you have current vaccination records, please bring them with you. Please do not feed your pet any food after midnight, the night before surgery. Please ask about any medications your pet takes non-related to the surgery, and should they be given the day of the procedure. Please make sure your pet is on a leash or in a proper carrier. Number 6. Follow these rules for 10 days after surgery. Take it easy. Your pet has no clue what just happened, who those people are, and why she feels funny. Let your pet guide you on how she feels while keeping her confined for the rest of the day. If you have a cat and used a pet carrier, set the carrier down and let her come out on her own time. If you're looking at how to comfort your dog after spaying, just having you nearby may be all she wants. Since the utmost care and superior surgical materials are used on surgery patients, a post-surgical problem seldom exists. However, because an animal walks horizontally, tremendous weight and pressure is exerted on a surgical incision. For this reason, the following rules should be followed for 10 days after surgery. Your animal should be kept as quiet as possible. Your animal should be kept in a clean, indoor environment. No suture removal is required, unless otherwise stated. Suture material will absorb. In female animals, there may be green or black colored tattoo ink in the surgical glue sealing the incision. Do not bathe, dip, or flea spray your animal for a period of 7 days. Advantage, frontline, etc. are okay. Number 5. Care after arriving home. Your pet has just been spayed or neutered, which includes general anesthesia and surgery. The following instructions should be followed carefully to ensure a safe and quick recovery. General instructions for all animals. Keep your pet confined where it will be quiet and warm. Do not place it on a bed or other high places. Keep your pet away from other animals and children for at least 12 hours. Offer water and food in very small amounts for the first 12 hours. If vomiting occurs, do not give anything else by mouth until morning. In general, lack of appetite, vomiting, or depression are related to anesthesia and may be normal following surgery. After 24 hours, any one of these symptoms may indicate a problem. Check the incision daily for excessive swelling, redness, oozing, or separation. Some swelling is expected. Do not allow your animal to lick the incision area. If your pet licks the incision area, you need to get an Elizabethan collar from your veterinarian to prevent problems. After bringing your cat home, he'll most likely be feeling some anesthetic effects. Typically, vets apply some form of protective ointment on his eyes to ensure they don't dry out. The ointment can cause the cat to have blurry vision. Consequently, you need to place him in a dark, warm, and quiet indoor location to recover for 24 hours after the surgery. During this time, it's important to keep your pets, even kids, away from the cat. Even the most affectionate and sweetest cat can become aggressive, biting or scratching anything when he feels frightened. The hangovers of anesthesia usually disappear within 24 hours. After this period, the personality of your cat usually goes back to normal. Vets recommend that you stay with your cat on the first night in order to observe his activity levels and carefully monitor your cat's recovery. Number 4, what about water and food? Once your cat gets home from the vet, you should give him water. The amount should be minimal to avoid vomiting. Only keep a small amount of water in a bowl and then top it off when necessary. When your cat is awake and alert, you should offer 1/4 to a half portion of his normal food intake. If he vomits, you need to take away the remainder of the food. Avoid offering food again until the following morning. The day after surgery, give your cat regular amounts of water and food. Don't be surprised if your cat or dog doesn't eat at all the first night. She may still be coming off the side effects of the anesthesia. If she does want to eat, then a smaller amount is a safe option. Number 3, medication. 24 to 36 hours after surgery, it's normal for your cat to experience some minor discomfort and soreness. As such, vets give pets a long-acting pain medicine in a form of an injection after surgery. Experts prohibit the use of most pain relievers, including those that contain acetaminophen, aspirin, and ibuprofen, since they're known to cause serious complications and, in severe cases, death. If you think that your cat needs pain-relieving medication, you need to contact your vet first. It's highly important that you follow the instructions of your vet regarding the medicines he or she will prescribe. Pain from inflammation can occur 5 to 7 days after spay surgery. Pain in cats is hard to detect since they do not respond to pain as humans do. Your veterinarian will provide you with any necessary pain relief medications. Do not stop medications without direct approval from your veterinarian. Inflammation and pain can cause secondary complications, such as licking the incision and swelling around the surgery site. Do not give your cat any over-the-counter pain medications or human pain medications. Many of these products can be highly toxic to your cat. If you are concerned about pain management, call your veterinarian for advice. Most veterinarians do not send cats home with antibiotics, as an ovariohysterectomy is considered a sterile procedure. If significant bleeding is noted during surgery, or if your cat is older and/or currently in heat during the spay, antibiotics may be sent home to avoid infection. Give your cat all prescribed antibiotics until they are completely gone. Do not stop the course of antibiotics even if your cat is feeling better or seems to be back to normal. A full course of antibiotics will prevent antibiotic resistance and ensure all harmful bacteria are eliminated. Number 2, washroom habits. As much as your cat chooses not to eat, he still needs to relieve himself. With that said, you should place a sparkling clean litter box close to your cat's resting spot for his convenience. It's not ideal to let your pet cat walk after the surgery. Dirt or dust from kitty litter find their way into the incisions and may result in an infection. For this reason, you need to utilize a shredded paper litter for roughly 7 days after the operation. The other thing you need to do is monitor his urine for blood. A tiny amount of blood may be evident within the first 24 hours post-surgery. But if you notice there is still blood the next day, it's high time to call a vet. The anesthetics given during surgery can cause diarrhea or constipation, which may last 24 to 48 hours after the operation. If you notice that your cat is unable to defecate or urinate normally within the first 72 hours post-surgery, you need to contact your vet immediately. Number 1, how long to keep a cat confined after spay? During the recovering period, you'll need to keep your spayed cat away from males for about 30 days. This includes both newly neutered and unneutered males. Neutered males can still get spayed females pregnant for about 2 weeks. A pregnant, spayed female can be an extremely dangerous and deadly situation. If you usually let your cat outside for free roaming, you're going to need to hold off for a while. Besides the host of bacteria your cat can be exposed to, there is also the risk of the bandage, surgical suit, or cone getting caught and your cat not being able to free themselves. If you can, get dust-free cat litter. If your cat kicks up too much dust during litter box activity, bacteria could be introduced to the incision site. Do let us know in the comments if you have understood how to handle your cat after surgery. please subscribe to The All Cats. Thanks for watching.